There's a lot of myeloma questions in the past couple minutes, so I'm going to switch to a stem cell transplant question for Dr. Kelkar. Dr. Kelkar, how long does a stem cell transplant procedure take, and how long is recovery? How long does it take to work? I presume the question is about allogeneic, but maybe if you can comment both on allogeneic and autologous, that might be helpful because I think patients might be experiencing either.
Yeah, so starting with allotransplant, there's a lead up period of usually what we called conditioning chemotherapy for the usually about 5 to 7 days before, depending on the regimen that you're getting. You'll get your stem cells infused usually on what we call day zero. It's like a rocket ship countdown for launch. And then after that, we start counting up in days. You'll usually receive treatments to prevent a complication called graft versus host disease in the coming days after that, usually somewhere in the first 5 to 10 days afterwards. And then after that, usually about 2 to 3 weeks after you get the stem cells, you'll engraft, meaning that the stem cell or your neutrophil counts will start to come up. And that will result in you being able to at least have some initial first line defenders that will allow you to leave the hospital or leave the transplant daily clinic and go back home and start seeing us on more like a weekly basis. So that's usually, that engraftment or somewhere between days 15 and 20 for most people is what we usually consider to be the end of that initial transplant period. But then for most centers, the first 100 days is a kind of very special period where you're very closely monitored, um, mostly for graft versus host disease, but also for infections and relapses and things like that. And then for most centers, and certainly for our center, the 1 year mark is the other big milestone. And that's usually the time period where we still keep people under pretty strict precautions for infections. And also kind of ends the highest risk period for when you could have a relapse. So those are kind of the three milestones. And then I usually don't call people cured for a few years afterwards, usually till for AML or acute myeloid leukemia, till about 4 years or so afterwards when we start throwing around that word. But that's for allotransplant, that's kind of the timeline we look at. For auto transplant, it's very much use dependent, and obviously we have folks from lymphoma and myeloma here who probably see this even more on an individualized basis. But generally, it's a shorter period to engraftment because it's your own cells, and we're not using immune suppression or anti-rejection medications to prevent complications. So people tend to have their cell counts come up faster. The preceding chemotherapy is often a little bit, or not often, but sometimes a little bit longer in the auto transplant setting for lymphoma, a little bit shorter for myeloma, but it's a much higher dose of chemotherapy because the goal of auto transplants is to give a high dose chemotherapy and then rescue the bone marrow with your own stem cells. Whereas allotransplants, typically the transplant itself is the treatment. And so in that case, we're hoping for those transplanted cells to fight cancer for you. Um, so for the auto transplants, you'll get chemotherapy before, you'll still get your cells on day zero. And then usually somewhere between 10 and 14 days after, for most people, they're going to engraft their stem cells, start having sufficient neutrophils and platelets to leave the hospital or transplant clinic. And then usually they'll follow up with their oncologist sometime in the next few weeks afterwards. And so the follow-up is a lot more center dependent for auto transplants. And the expectation of time of duration of that treatment in terms of response is very much dependent on the type of disease and the risk status of your disease. So for multiple myeloma, I think traditionally, and Dr. Cooper, you can correct me if I'm wrong, but usually we think of it, I was always taught that you expect about a 2 year remission on average, or somewhere in the 1 to 2 year range. And then for lymphoma, we're usually going for cure when we use auto transplants. So it's the two different uses there. Um, and then it was, auto transplants used to be used for other things like leukemias as well. Although a lot of the recent research has showed that most patients relapse very quickly after auto transplants, and so that's why we almost always use allotransplants for leukemias and MDS.